The main toxicities with TAS-102 that we're seeing in the study, and I think are seen clinically as well, are fatigue, neutropenia, some nausea, vomiting, and a bit of diarrhea. But really the main toxicity that I think affects patients in clinic and affects management is neutropenia and fatigue.
When we face the decision about how to treat patients with refractory metastatic colon cancer with TAS-102, we approach TAS-102 in many ways more similar to how we would discuss side effects of fluoropyrimidines, which is talking about the cytopenias, talking about the possibility of fatigue, of course, but in particular, we want to make sure the blood counts are monitored safely. So we tell them a CBC, sometimes as often as weekly, is indicated in the early going, just to make sure that they're on the proper dose of TAS-102. When you're on it for a little while and you start to see a safe parameter of neutropenia that you're comfortable with, or thrombocytopenia, then it becomes an easier thing to manipulate. So TAS-102 is in many ways, the toxicity profile for many oncologists is more comfortable because we're more used to dealing with cytopenias than we are with so many other side effects induced by other drugs.
In my personal experience, the toxicity of TAS-102 is largely neutropenia, fatigue, and nausea. And the latter two, fatigue and nausea, are quite manageable with antiemetics, if we need to take a brief break, patients usually recover. It's usually not a major factor that limits the ability to dose or limits the patient's quality of life. And for neutropenia, we have been able to successfully manage that just with dose reductions. Often patients don't actually need to stop the drug, but we always have the option, of course, of growth factor support as well.
Usually the dose reductions would be based on the prior count. So if in the package label for TAS-102, the dose is given 5 days on, 2 days off, 5 days on, 2 days off, and at the completion of those 10 days of dosing, there's a 14-day break. So you have the ability to monitor the blood counts, check the CBC, use those as dosing strategies for subsequent cycles. If other side effects are being induced, including fatigue or some intolerable other side effects which can occur, the dosing strategy involves dropping usually 1 pill at a time to get them down to a dose level that is also sustainable.